Consumer use of telehealth services has exploded in the past 18 months. Parks Associates' latest data shows that 64% of consumers used a telehealth service in 2021, up from only 15% in 2019. Beginning in 2020, telehealth and telemedicine solutions were thrust to the forefront of healthcare as a result of the COVID-19 pandemic. The need to avoid exposure to the virus has reversed well-established consumer preferences for in-person visits over remote care. Radical shifts in the regulatory and reimbursement landscape have paved the way for rapid telehealth deployments. Our new quantified consumer study, Virtual Care, Connected Health Devices and Services, provides trending data on 5,000 broadband household responses about familiarity, use, and demand for telehealth services and connected health devices. It evaluates user experience with these services and consumer demand for virtual care as a standard offering. For more information on this new research, please contact our team at sales@parksassociates.com.
Everyone, and welcome to our second day of the Connected Health Summit. Here we're going to discuss some of the very interesting trends that are happening right now in the business model space, taking a look at really answering the question, who's paying for healthcare? If you haven't met me before, I'm Kristen Hannock, Research Director here at Parks Associates. I cover the connected health market, really taking a look at all of the very interesting trends that have been going on in the past few years. We have seen really the exponential growth of telehealth service adoption, as well as the many changes impacting the remote patient monitoring space. So a great deal of developments. As a reminder, YourPath gives you access to our full series of virtual events here, including all of the past events that have happened beginning in January all the way to the event happening here today. So you're able to access all of these recordings. You're also able to get access to our next event happening on October 6th, taking a look at the seniors and caretakers market. As a reminder, we also have a series of different events across really the entire spectrum of business, including our Connections Summit, taking a look at a lot of the trends in the IoT space, our Smart Energy Summit, Smart Spaces, our new event taking a look at what's going on in the MDU market, our Connections events, Connected Health Summit, and the Future of Video as well. Before I get started, I'd like to give a special thank you to our sponsors, including our sponsors ADT Medical Alert, Alarm.com, EarlySense, Johnson Controls, Rapid Response Monitoring, Becklar, and Independa. Thank you all so very much for making this event possible. As well, a special thank you for all of our supporters for helping to keep everyone engaged. So today we are going to be covering quite a few different topics. I'm going to be kicking things off with a 15-minute presentation, taking a look at really what has changed in the area of healthcare, especially in the business model front. Next, we're going to be going into our interactive panel discussion, taking a look at business models and tech of the future. Joining us today will be Iris Berman of Northwell Health, Mitchell Fong of Renown Health, Josh Locke of Essence Group, and Dr. James Molt of BioIntelliSense. So very happy with this excellent lineup of panelists. We're also going to be having a keynote from Karen Silgan, the General Manager and VP of Virtual Care with United Healthcare. So she's going to have some very interesting things to say. Afterwards, we'll be going into an interactive panel looking at the consumerization of healthcare with Jeff Cutler of Ada Health, Dr. Jeffrey Rutledge of HealthTap, Atul Singh of LG Electronics, Kristen Valdez of BeWell, and Brad Wiltz of A&D Medical. So yes, over the past few years, we have seen a really radical transformation of the healthcare space. Telehealth adoption has gone from something marginal, only used by about 15% of consumers, to really majority adoption. We saw here with Parks Associates with our consumer survey data, adoption rise from about 15% to over 2/3 of consumers. So really a meteoric growth. As this has happened, we have seen all these evolutions in care delivery methods as well. Consumers, instead of going to the in-person visit, were more likely to pick up the phone, call their doctor, be able to do a visit that way. Two-way audio-video interactions flourished. We also saw the rise of text and chat-based services, which had a major kickoff in adoption as well as the televisit. As I mentioned, remote patient monitoring grew. More and more patients getting different kits of devices, being able to actually send their data back to their care provider. With this evolution in care delivery methods, we have seen the growth of more and more omnichannel care. So rather than being forced into a single mode of delivery, patients are really able to select the mode that fits them best, and care providers are able to offer what is a best fit for that patient. We've likewise seen the birth of what has become known as virtual first primary care. So primary care services that really make use of the virtual experience to offer a cohesive approach to care, where you have the patient as the center of the ecosystem, all of the data feeds into the care provider, and the data is through the packet of devices that they might have issued to them when they first join the program, or it might be all of the specialists who tie into this ecosystem. So this is, again, lending itself into the rise of more and more integrated care delivery models, helping to solve some of the fragmentation that we've seen. We're also seeing the rise of health at home with more and more hospital at home programs, more and more remote patient monitoring programs, of course, being able to do a visit within the comfort of your own home as well. This shift to omnichannel care delivery is really helping to move patients beyond the digital storefront, where you have your first experience to the care platform being maybe you go to the website, maybe you have a symptom checker app, maybe you're reaching out to your insurance provider trying to find the right care provider. And it tries to route you to the appropriate provider, the appropriate level of care. So this is really helping to move beyond that to an actual virtual healthcare system. Not a separate system, but one that is actually integrated with the in-person care that you receive through your standard care provider, your local health insurer, or maybe a platform that is virtual from the first as well. This is really helping to reach patients where they are, just using the most appropriate technology and platform. We've also seen that many of these approaches, whether it's an app-based approach using digital therapeutics, or a device-based approach, including remote patient monitoring, remote diagnostics, is really helping to improve care outcomes for very many conditions. One of the most well-known conditions is, of course, that of diabetes and diabetics, where having the information to track blood sugar and being able to tie it back to what you've eaten in the past 10, 15, 20 minutes is really helping to improve the patient's ability to care for themselves and helping to get much more accurate information about lifestyle choices. We're seeing as well that this omnichannel mode of care delivery This is happening both through care providers launching their own platforms, as well as through partnerships between standard telehealth companies and in-person providers as well. So lots of very interesting movements in the space. We've seen as well over the past few years, I mentioned before, the rise of more and more virtual first primary care solutions. Some of the announcements that have been made include companies such as CVS Health, Amwell, Alkalite, which owns PlushCare, Teladoc, Doctor on Demand, so some very big names in telemedicine. We've also seen some insurers launch their own solutions, either in partnership with some of these names or building out some of their own systems. So United Health Group offers a virtual first primary care plan, Humana, and also Aetna. So lots of very interesting movements, and we'll see over the coming years how much of a change this is going to have in the market. As I mentioned, there has been a major problem within the healthcare, and that is that of fragmentation. We're seeing with the launch of more and more of these virtual solutions, the launch of more and more telemedicine programs, that there has been this increased emphasis on having a single integrated approach to care, one home where the patient's records resides, one home where the data flows. This approach is also helping to more easily allow physicians and care providers to address the various comorbidities that a patient might have. We're also seeing with different telehealth platforms an increasing emphasis on adding mental health to the story as well, which is really helping to improve patient outcomes and drive engagement. A lot of these virtual platforms are really also helping to improve communication across the entire care team. So historically, you had to rely on maybe your patient to go visit a specialist, and if you were lucky, they would bring back the paperwork and send you the records. With a lot of these new solutions, we're beginning to see improved communication through automatic record sharing, being able to do just immediate virtual consults with another physician in the kind of the comfort and safety of your own office or your own home. This is really being enabled by the digital tools that we've seen rapidly grow in adoption over the past few years. So certainly a massive transformation, not just in terms of patient adoption, but also in the internal workings of care systems and care providers. However, as this major evolution has happened, we do see that there are still a number of challenges and uncertainties that need to be addressed. Over the past few years, of course, as I mentioned, we saw this major growth, but it was largely driven by some pandemic-related pressures. These pressures with the COVID-19 pandemic out of the active pandemic phase, they're more or less winding down. So we are beginning to see a bit of a return towards more normalization. The question is, where exactly was this going to shake out? What will normal actually look like? We do expect to see, of course, some permanent expanded use of telehealth, adoption of telehealth, remote patient monitoring, and new technologies. But at the same time, we do see some reversion occurring. Some of the consumer survey data that we shared yesterday showed that telehealth usage had declined from last year to this year, from 66% of consumers down to 55%. So a little bit of a decline, but it's still majority adoption. As everyone knows, we're also navigating something of an uncertain macroeconomic environment right now. We've all heard the news headlines about rising interest rates and different uncertainties. Companies are also having to navigate these environments as well, taking a look at what they expect to be on the market and on the horizon in the coming weeks and years. We're also seeing some regulatory and reimbursement uncertainties. A lot of the changes that were made for the duration of the COVID-19 public health emergency with the emergency use authorizations. When that expires, nobody's quite sure what exactly is going to be supported and what won't. We've seen some changes hit, but not everything that needs to be done has been done yet. However, the overriding question that we have to answer is really, what do patients want and what do care providers want? We've seen that across the healthcare ecosystem, different players are really looking at different things. Healthcare payers, of course, are very interested in using telehealth, remote patient monitoring to cut costs and really improve their care populations. We've seen that many healthcare providers are interested in these solutions, but smaller providers in particular might not have the chops in order to really fully leverage the technologies and have the best approach. Many tech vendors are also having to navigate potentially choppy waters as care providers are not necessarily sure what they can and cannot do. Consumers, of course, are also beginning to take a look at what they would really like. We've seen that a lot of them are now much more familiar with telehealth than they've ever been in the past. They're very excited about remote patient monitoring, but there's still that question of whether or not they're going to be seeking out a traditional care experience. Next, we have our panel looking at business models and health tech of the future. That's going to be tackling some of these very interesting questions.
Thanks, Kristen, for that great opening to our session today. Hello, everyone. I'm Jennifer Kent, Vice President of Research with Parks Associates, and so pleased to be bringing this panel discussion to you to focus on the business models and health tech of the future. A future, as you just heard from Kristen, that will certainly include virtual acute and even primary care services, remote patient monitoring, and an omni-channel approach to delivering access to care. We have a fantastic lineup of speakers to get into this discussion today. I'm going to ask that each of them introduce themselves and tell us a little bit about their organizations and their role. I'd love to start with Iris Berman, who's the Vice President of Telehealth Services at Northwell Health. Hi, Iris. Thanks for joining us today.
Hi, thanks for having me. I'm really excited to be here today and also to hear from my colleagues. I am the Vice President of Telehealth Services at Northwell Health, and we are the largest healthcare provider in New York, and we are the largest employer in New York. It makes us very unique in terms of our impact in a variety of areas. We have over 850,000 emergency visits a year, and we've had a fairly robust telehealth program even before the pandemic. Certainly the pandemic accelerated it, and we're looking at what steady state might look like. I'm not sure there's ever going to be a steady state, so I'm really interested in going over this with everybody today and talking about novel ways and innovations in the use of telehealth. Great to meet you all.
Great. Thank you so much, Iris. Very much looking forward to hearing more about what you've seen over the past couple of years and how your programs are shifting even. Next, I'd like to introduce Mitchell Fong, who's the Vice President of Virtual Care with Renown Health. Hi, Mitchell. Thanks so much for joining us today.
Hi, Jennifer. Thank you for having me. Pleasure to be here. So I'm
Tell
Mitchell
us a bit about Renown.
I'm Mitchell Fong. I'm the Vice President of Virtual Care here at Renown. So that's everything from your remote monitoring, your traditional telemedicine, your direct-to-consumer, as well as any acute services that we offer using technology. We're located in Northern Nevada. We cover about 100,000 square miles, which in all is a little over 1 million patients in that area. We focus on different communities with the hub and spoke model. So we've partnered with the prison systems in the state of Nevada and California, tribal health communities, critical access hospitals, and rural health clinics all across the board. And so really excited to share some of the work that we've done and some things to keep in mind as we look to expand equitable access to care for all patients. Thank you for having me.
Fantastic. Thank you so much, Mitchell. Next up, we have Josh Locke, who's the Vice President of Sales with Essence Group. Hi, Josh. Thanks for being with Connected Health Summit. Tell us a little bit more about yourself and about Essence.
Hey, Jennifer. Thanks a lot. Yeah, so Essence is a global manufacturer of IoT solutions. In business for over 28 years. Just purely B2B, so we're not a service provider. So what we specialize in is customizing products to meet a consumer or patient need in the healthcare as well as security worlds. Here in the United States, we focus a lot on healthcare solutions for our customers, spanning from basic, PERS service providers all the way to remote patient monitoring providers as well. So really, we customize in platform integrations, providing platforms ourselves to service providers to be able to provide these innovative solutions to their customer base. So great to be here and great to contribute to this panel.
Thank you so much, Josh. And finally, we have Dr. James Malt, who's the CEO of BioIntelliSense. Hi, James. Thanks for being here. Tell us a little bit more about BioIntelliSense.
Yeah, hi. Looks like got the double signal. So BioIntelliSense is a two-headed beast. It's been developing systems for continuous multi-parameter remote patient monitoring with a new medical grade wearable. And then combining that with data science and the ability to generate clinical intelligence and be able to watch that data, identify trends that may indicate earlier patient deterioration, and create opportunities for early intervention and reduction in utilization and cost of care. And right now, with the critical workforce shortage, a lot of hospitals and health systems are really struggling to keep doing what we've been doing for 100 years, which is highly manual, labor-intensive, repetitive processes to collect a small amount of data. And where we're headed is the ability to make this simpler and less expensive to acquire, far better data, and therefore have better information to take care of our patients.
Fantastic. Thank you so much for bringing your expertise and insights to our conversation today. So I'd love to start off, and I'm going to go to Mitchell and Iris here first from the health system perspective to ask if you can help us understand how business models, when you think about virtual care and the various models that covers, that umbrella term covers, how you see business models really changing and shifting and evolving. Are you starting to see things kind of shift back to where we were before the pandemic, or has the landscape really changed permanently? So Mitchell, I'll start with you and then go to Iris.
Yeah, thank you. Great question, first of all. I think we're seeing kind of the shift to hybrid, not quite back to where it was before the pandemic, but I don't think it's anywhere near where the potential is for it to continue to go downstream. When we look specifically to capitated models or managed care models, we're seeing a huge uptick in the virtual utilization of just different ways to use preventive medicine, lower cost, similar or higher quality care that we can use. And so overall, I think really as we look at how we're engaging patients in different care settings and how can we be actionable in real time to bring that right care at the right time in the right place, a lot of times we're determining that using technology, we can actually deliver that quality care outside of our brick and mortar facilities. So I do think there is still an uptick of virtual, not quite to the levels we saw during the pandemic, but I also think we're seeing a more innovative and strategic approach to how we're using the digital tools. I think during the pandemic, a lot of it was very response driven to the capacity needs and the challenges that we had in the community with the shutdowns and the lockdowns. And now as we're trying to use technology, it's very strategic in what can help us gain efficiency, what will help us reduce burnout, how can we deliver higher quality care, but doing all of that in a setting that doesn't require the patients to physically travel to us as much as possible. And so that's kind of what I'm seeing in the market there, but I look forward to what Iris has to share as well.
Yeah, and just a quick follow-up there, Mitchell, and then we'll come to Iris. So I love your point about being more strategic, kind of going from a reactive, what do we need to do to get through this particular period with capacity, to being more strategic. Can you give us maybe an example of where you feel like you're being more strategic today? Is it more about that digital front door and first evaluating folks virtually if that's how they want to engage with you, or is it more about chronic conditions or discharge? Any examples you can share would be great.
Yeah, great question. I think it's actually across the continuum that we're seeing that. I think holistically, health systems are planning for a hybrid future and then using that across the board from all the examples you gave. How do we engage patients? How do we discharge them sooner? How do we monitor their success when they're at home and recovering from an acute stay across the board? So I really think it's a little bit of all of those areas that we're seeing some of that strategic innovation. But really, I think a very simple example comes with your direct-to-consumer virtual visits. During the pandemic, we were using that for every single specialty. And what we've learned is that not every specialty and not every service is really appropriate for that direct-to-consumer virtual visit without those other modalities and the peripheral tools to augment that visit. And so I think that might be one clear example where we've seen a huge benefit in the behavioral health space. High value, high touch, significant engagement from the patients and satisfaction. And so hopefully that's one example of where we've been a little bit more strategic with where do we deploy technology in the right way.
Yeah, thank you for sharing that. Iris, to you, how your approach maybe has shifted over the past year. We're pleased to have been able to hear how Northwell Health kind of came through the height of the pandemic with you speaking with Connected Health Summit previously. So really interested in where you feel like the programs are at now, and especially kind of the business side of things.
Yeah, I do think there has been a huge shift. As we wait for regulatory dust to settle, if you will, we've always thought of telehealth as a tool in the tool chest, if you will. But really what we're looking at is integrated care now. And I know that Kristen mentioned it earlier, but it is truly the focus as well as access. That is our number one focus really for our communities at large, is all about access. And so how does telehealth and remote patient monitoring improve access? And also in a newer paradigm where the patient is our client and they own some of the responsibility for their care. It's not just upon us as a health system. Certainly we need to support it, but what tools can we give them that improve their achievement of normalcy within their disease framework? So that's a lot of what we're looking at. Very, very integrated care, a lot of projects around the hybrid world. I would say rather than hybrid, that it's the great connector to the acute care and ambulatory world and everything in between. And so we're trying to create templates of care, if you will, that improve that throughput. And I don't mean through our ERs, I mean through our health system in a more efficient way, and then leveraging technology, for example, things like multidisciplinary conferences where everyone's in the room at the same time, as opposed to one appointment at a time, and being respectful of how time is utilized by both our patients and our providers, and really to provide a delightful experience in the healthcare realm, which is not something we've been able to say very often.
Yeah, that's a little bit of the holy grail of the concept too, of kind of medical home and having a particular care provider that can integrate, a single patient's, view across the providers, actually having them come together all at the same time. I mean, that's really kind of delivering on some of that promise. Well, I'd love to get the perspective also sort of from the devices side. So Josh, I'll come to you next, and then James. Obviously there's much more demand for the devices and the sensors that are making a lot of the remote work possible. So I'd love to understand how you're seeing the market shift in demand for your services, and also the business models that go along with that. So Josh first, then I'll come to you, James.
Yeah, sure. Thanks, Jennifer. So, as a manufacturer and, a customizer, basically, for our service providers, we get the demand that comes from the end user, basically. So initially, a couple of years ago, it was, I need the data from chronic disease, for chronic disease management from the peripherals to show up and have some type of severity. Today it's more about scaling that. It's about the scalability of it, and I can't have somebody calling, a person calling this person to take their measurement multiple times a day. So really what we've been focused around for the last 12 months is really the customizing per program that type of compliance piece that can be virtualized, through voice, through the hub in the home, customized per person or per patient population. but really having it just a turnkey, scalable thing where you're not having humans do this compliance calls to have, Sally Jones step on a weight scale, for example, several times a day. That's been a really big focus for us. And it's, again, all driven from our customer, the service provider, which comes from, their demand of being scalable. So that's one big trend that we're seeing. The other is that it's really expanding outside of, remote patient monitoring is expanding, and really monitoring in general in the home, typically for the elderly, but also for anybody that suffers from a chronic illness. It's expanding out from just being physician groups and specializations and health plans and stuff like that. It's expanding into smart home stuff. There's smart home companies that are expanding into healthcare, like remote care, like activity monitoring, innovative approaches to summoning for help. So like lifestyle and life safety type devices, wellness, activity monitoring, wellness, step counting, goal setting, and even into remote patient monitoring. And so they're looking for a unified platform to provide, every piece of that all at once, or each individual one, right? So it's very patient-centered or consumer-centered. They might just need the medical alert in the home. They might not even want to wear a wearable. So they want some different solutions like radar fall detection or voice activation. And then they might evolve into needing activity monitoring. So putting in different devices in the home that monitor the activities of daily living and engage caregivers in that, so that the caregiver can come in and just look at an app and go, okay, mom's up and moving and making coffee and watching the Today Show. So like she does every day. So I'm good, getting that value every day. But then layering on, the remote patient monitoring aspect of it all through one unified platform. So we're seeing it come from both angles, right? We're seeing it in the, traditional medical alarm monitoring space, or PERS space, right? Where you have a brand selling a box and a button to a caregiver or to Sally Jones herself, right? And then they're upticking, right? They're offering more value. So it could be a medical alert that's connected to a cloud that has an app that gives you thumbs up or check marks that says, hey, your mom's wearing her pendant, the pet battery's fine, right? That's kind of the initial approach to it. And that technology has been around for years, however, not connecting it to the cloud. That's kind of a more recent thing in the last 5 years. But those companies transitioning into being, adding more components to it, to provide more data, like she spent this much time in the kitchen, providing that day story, and being able to associate rules around that, to be able to kind of get smarter about caregiving from afar. So that to me is all it's remote patient monitoring. It's telehealth. It's being the ability to access for help from someone who knows who you are and knows your basic diagnosis and health, and knows who to call in the event of an emergency. So we're seeing it come that way. And then we're seeing it also from mature remote patient monitoring and telehealth organizations that want to provide everything underneath that, right? Mm-hmm. They might have a bring your own device now, that they're selling, or a tablet type of approach to remote patient monitoring that's connected to all these devices. But they're missing some of those key components that are, relatively, you could call it more simple, but also provide that extreme amount of value in the overall, umbrella of the person's care. So that was long-winded. I'll let James opine here.
That's all right, Josh. No, but you touched on a lot of great themes here, especially the fact that we've seen these two kind of ways of approaching and caring for the consumer in a virtual way grow up in their own almost own ecosystems in the
direct to consumer versus through the care system, and starting to see those integrate, which I think is the vision a lot of us see, especially looping in family caregivers, et cetera. So James, to you, love to see the trends that you're seeing, and also, of course, BioIntelliSense with a sensor-based approach, right, is really interesting. A wearable sensor versus a wearable button or device, and that's kind of a different approach too. So love to hear your thoughts on the kind of shifting winds.
Well, thanks, Jennifer, and to my fellow panelists, I think we're all of the same mind. What, for better or worse, I've seen doing this for now 2 decades, and helping build the early capabilities with things like the Health Buddy, and then Health Vault at Microsoft, and then even at Qualcomm, building out the wireless connectivity. For the past 20 years as a cardiac surgeon, it's been very clear, taking care of patients day to day. It's the data that allows us to be able to understand what's happening to somebody and make an interpretation, a diagnosis, and then a clinical treatment plan. Unfortunately, our collection of that data, that essential data, has been highly manual and labor intensive, and fundamentally hasn't changed for over 100 years or more. As you saw on that first slide, 1920, that was a slide of a nurse walking around room to room to take somebody's vital signs, and we can only afford to do that, once every 6 hours. Now 100 years later, we still have somebody walking around room to room taking somebody's vital signs, for a dramatically higher cost point. And that's just in the hospital. Outside of the hospital, we basically have no data. So when somebody leaves the hospital, having a nurse case manager call them, we've been able to do that for decades and check on them. A web camera makes that telehealth and allows us to look at them. But whether you're on the phone or you're looking at them on a Zoom camera, you don't really know what their temperature is, or their blood pressure, or their respiratory rate. You need objective data if you want to take care of people. And the sad reality, and our provider friends, Iris and Mitchell know this all too well. Our hospital systems right this very moment have hit a brick wall that is staggering. I've spoken, and it's public. There are hospital systems that are losing tens of millions, if not hundreds of millions of dollars per month and per quarter right now because of the nurse labor costs. And even at any cost, a lot of hospitals are struggling to be able to staff their beds and are closing beds for weeks at a time. So we're in this, and it's not going to get any better. The forecast is we're currently lacking 1 million nurse positions filled today, and that's going to grow to 3 million by 2026. So this is a kind of a forcing function that is pushing hospitals to figure out how to move from a 100-year-old manual data collection process to something that is smarter and actually can generate better, more frequent data, and do it at a fraction of the cost. And that's what we're all about. And that's what's happening. In fact, this morning we made, I think, a very exciting announcement of our new strategic partnership with Medtronic, which gives us the ability to take this capability, which is fundamentally changing how we can create better workforce efficiencies, while at the same time getting more frequent data to see what's happening to people in the hospital and for the first time at home, and start to talk about reducing length of stay, being able to take care of people at home. But I think Josh also alluded to this. It is a non-starter if you're going to generate all this amazing new low-cost, high-frequency data. If you don't move away from this labor-intensive watching the data behavior. Every other sector of our society has evolved to something that's called exception management. And that's exactly what has to happen here. It's a combination of better data, but also being able to be smarter about how that data is applied. So that's where algorithms, basically data science, can watch that data actually better than we ourselves as humans could possibly do. We can keep an eye on this, we're measuring 1,440 sets of vital signs per day with, a little button on your chest. It's effortless. The patient doesn't know, they don't have to do anything. There's no effort on the part of the patient or the staff. Suddenly you're generating all this data. But then what you want is for cloud analytics to be able to watch that data minute to minute, hour to hour on a statistical basis. And out of 500 patients on a dashboard, let one nurse case manager be able to see the 20 that need attention. And then that's the moment to use the complementary capabilities of telehealth. If you've got somebody at home, you can watch 1,000 patients, very effectively, and have better monitoring than you've ever had even in the hospital. And then those individuals that trigger a concerning trend, then you have the opportunity to say, okay, we need to do a telehealth visit with that person, or maybe this one, we need to send a nurse to the house to check on them, or bring them into the clinic. And this is when it becomes really, really rational and scalable for the first time. I mean, you're going to see us look back 20 years from now and just be appalled at the fact that we used to send somebody home from the hospital naked. In other words, we shake them on the hand and pat them on the back, and we say, here's a list of stuff that you should watch for, and tell the family, now it's your responsibility to make sure dad doesn't die.
Right.
And the family is in a panic. They don't know what to look for. So this changes everything. And sadly, it usually takes a crisis and some forcing function for us to, move out of old tradition. A lot of what we do is just tradition. There's no real basis to it. And that's what's going to be fun right now, is with real data, especially for the first time outside of the hospital. If you make that effortless and inexpensive and medical grade, I'm sorry, but I've got a soapbox there. Your consumer wearable is not the basis of making life and death decisions. So medical grade matters. The reimbursement codes require that it's an FDA medical device, and that's what's going to change our ability to be able to eliminate these artificial boundaries and take care of patients wherever they are appropriately need care. And I think you're going to see hospitals over the next 10 years, move more and more patients out early, and the food's better at home, and it's a lot cheaper. All right, thanks.
Yeah, well, I was saying the bed's better too, right? And
that's
much
right.
Lighter, much darker.
Well, and the hospital is where all the sick people are. So the longer you're in the hospital, the more exposed you are to the things that you probably don't want to be exposed to. And everybody wins. Nobody wants to be in the hospital. Hospitals are happy if length of stay goes down, but you can't just send them home and, with a pat on the back and, cross your fingers. So I think hospitals are going to become really acute care facilities where if you need to be in the operating room and the intensive care unit, but now we have a means to be able to start to take really good care of people with good data at home.
Well, I appreciate that real, vision. I mean, we are talking about the future here, right? And the pieces are aligned. What you're talking about also is really automation that all of these other industry sectors have gone through already, because all these other industry sectors digitalized, right, their operations and their records decades before healthcare. And so we're behind the ball, but things are starting to come together. I'm going to tell the audience, we have a polling question in there that we'd love to have you answer. So if you haven't had a chance to check out the polling tab, please get your responses in, because I'm about to go to that in a second. And also, we do welcome questions from the audience. And I meant to say that at the top of the hour, but if you do have questions for our panelists, please enter those. We'll make sure we leave some time. So what I'm asking the audience, and I'll go to Iris and Mitchell here for your thoughts, is really about where they see the greatest value in virtual care, especially thinking kind of financially and where the money is, right? When you're thinking about your operations, right, and kind of the business side of things, is the opportunity really in looking at revenues and fee for service and reimbursement and making sure that the reimbursement is there to make virtual care a sustainable situation? Is it more about cost savings from across the ecosystem, whether that be because we're detecting and intervening and preventing care, right? Or, better staffing and utilizing your facilities the most efficient way possible? Is the opportunity more in this direct-to-consumer products and services where the consumer is paying for some of the virtual care services and products that are available? So Iris, love to come to you first on your thoughts, and then Mitchell.
So what I would want to say is yes, but I'm not going to do that to you. The truth is, it's a little bit of all of that. I would say that one of the things we're really realizing is we're not going to sit there and wait for regulatory bodies to decide what's going to be reimbursable. We have to think about what the downstream impact is of using that technology, whether it's what James was talking about with regard to the fact that we have a nursing shortage. And by the way, I hail out of critical care nursing, and nobody knows this better because one of my first forays into telehealth was in the tele-ICU world before the pandemic. And it was already becoming evident that there's only so much the human being can do. However, we need to be very careful that we're not removing the human touch, and I mean that, and the intuition from the process. So I think, again, going back to that hybrid model, what we're really looking at is diminishing latent recipients of care. In other words, getting to people sooner, being a little bit more proactive. That's where the bang for the buck is. If we can do it better and do it a little faster, and great if we can save some money in it. We need to. We're one of the few industrialized countries in the world that spend so much money on healthcare and yet don't get our top outcomes the way we would like to see. So I believe it is really a mixture of all of those things. I do, though, again, want to caution about completely detaching the automated pieces from the intuition that an experienced critical care nurse has, an intensivist, a cardiothoracic surgeon. We trust more and more AI, certainly, and integrated predictive analytics, along with a very good pathway to allow all of us to work at the top of our license so we can maximize our ability to see as many people as we can in a quality way, as opposed to just another number. And we need to humanize this too. I don't want to forget the humanity in all of this. So it is, again, a pathway. And I think the big bang for the buck is if we can make people healthier.
Yeah, absolutely. Love that perspective. Mitchell, to you, how are you all thinking about it at Renown?
Yeah, I'd say Iris really covered a lot of it, but it's about the quality of life impact that we can use with virtual health. And I think the big point Iris made is that we have a huge healthcare deficit from a financial perspective, but yet we still have so many people in America that don't get the right care at the right time, that don't have the coverage. And so I do think there's an aspect of it that financial, absolutely. But when we think of that, there is a shift going towards managed care or value-based care, if you will. But I don't think there's ever going to be a health system that's fully fee-for-service or fully capitated. That's just not how it'll likely work, at least in the near future. And so you have to be able to balance your preventive measures with your fee-for-service to make it a sustainable platform or product that you're offering. And so I think there is that balance that you need to have when we look at the importance of scaling and where technology can really play a factor. But it comes back to what Iris said and what Dr. Maltz was saying earlier as well, is bringing the resources to the care team and to the patients to empower the patients is extremely critical as we move forward, knowing that there's likely a shortage in healthcare resources. It's also about the experience for the clinicians so that they can treat the patients that need that highest acuity care at the right time. So the more we can use technology to be preventive in real time and then also respond reactively outside of our system walls, never losing that human touch, but further expanding the reach of our resources and the capacity to service more patients at scale, I think is really where we're seeing the technology come in and have that benefit. And so for us, it's really that balance of creating that high quality, equitable care while controlling costs at the same time. And it's something that in healthcare, we've been so antiquated in really moving forward that we haven't had this opportunity, the technology revolution, as you stated well earlier, that other industries have. And so I think this is the opportunity to figure it out, but we can never sacrifice safety, quality, just to gain efficiencies in healthcare, because we're dealing with human lives and people satisfaction.
Well, so our audience really agreed. 75% said it's cost savings really about across the healthcare ecosystem. Nobody's really waiting for reimbursements to be figured out, is what's available today going to stick? We're not sure. And I imagine that from a planning perspective, right, you're having to make your bets and place your budget where you see, the best strategic placement possible, not necessarily knowing what's going to happen on the reimbursement side. Josh, I'd love to, please, go ahead.
I'll just say, I agree with that completely, but that's where my call to action for everyone listening to this is that's where we need to work together to help influence the legislation. If we really want to make this sustainable, the beauty with what CMS has announced is that they are willing to consider and look at where new technology can make a meaningful difference, albeit with the right quality and the right satisfaction. So I think it's all of our accountability and responsibility to push forward together to create products that may not be reimbursable today, but quantify the impact that it can have so that we can fight for that right reimbursement downstream and truly create a sustainable infrastructure to use digital health in a very effective way.
Yeah, I want to really just very quickly echo on that. I think one of the things that they're going to be looking for is a lot of data that supports the effectiveness of the care. And it's been stated as such. And if we get to HR 4040, that's exactly the purpose of that time, is for CMS to gather data over those 24 months to see where it leads and what is reimbursable based on outcomes. So we need to be focused on quality, outcomes, measurement, and start to standardize some type of data dictionary around all of the technology we use.
Yeah, but I would caution. We are facing a tsunami of biblical proportions as it relates to our healthcare economics. As Iris pointed out, we're already spending double per capita on healthcare than any other Western country on the planet. So the hope of getting more reimbursement per se, I think is going to be short-lived. And what this is about is we're all already spending an outrageous amount of money on our healthcare. We're just not being efficient about how we
are applying it. And I actually have a slide in my slide set, Iris, that you would love, that says high tech and high touch are not mutually exclusive. The point is that we've been embarrassingly, frankly, stupid about how we deliver healthcare, and it's pretty haphazard. We spend a lot of money, chasing, crises, and not being able to get a heads up and get in front of it before somebody shows up in an emergency. Inexcusable. We can be better than that. We can use technology to help us be smarter, to help us be more efficient. 70% of our healthcare costs are labor. I couldn't agree more. We don't want to reduce the face time with patients. However, we all as clinicians would be better off, and our patients, having more time to spend with the patients that need attention and a little less time with the patients who are perfectly fine. The problem was we're really poor at figuring that out. So we waste a lot of time and energy and cost on fire drills for stuff that we weren't paying attention to. And keep in mind that the third leading cause of death in the United States is our own healthcare system. So we're making a lot of unfortunate both errors of commission, but also errors of omission. We just, we call it subclinical, which is an excuse for all clinicians to say, oh, it wasn't obvious to us until it was, really bad. But, it's an exciting time, but a lot of things are going to change here over the next 5 years. And the healthcare economics are going to be less and less forgiving of kind of 100-year-old traditions that are sadly quite inefficient and antiquated, and actually are poor care.
Now we have a few questions from the audience. We have just about 4 minutes left, and so I'm going to take two and hope for some quick responses, and then unfortunately we'll be out of time. So the first one's going to go to you, Josh. So we have a question actually about providing devices to homes where people, certain populations and people might have unstable or temporary living conditions. Obviously, there's a lot of support that might have to go along with kitting the device and making sure consumers know how to use them. How about when certain populations are moving location, and does that disrupt operations at all? And are you seeing any issues there?
Not really. Not really in that category. Most of our customers, the end customers, are staying in place, not really moving. However, you spoke to unhealthy environments, so that could be, a dangerous environment and stuff like that. Having that emergency response aspect of it, or concierge, or, ability to summon someone quickly is an important piece to any type of remote patient monitoring program. But you touched on easeability. Yeah, it's very important that these connected devices, these medical grade FDA certified devices, need to connect easily, reliably, through Bluetooth, likely, not the old wire ones that we had, 10, 15 years ago. But it needs to be easy and seamless. So that's what we focused. That's part of scalability. If you get a box at your home and you open it up and it's hard to deal with, it should be just plug the hub into the wall, click on the power, take your reading, works, right? And it gives you some voice acknowledgments and tells you, hey, I got it. Nice job. You know what I mean? It needs to be that simple. Right. So if they can take that with them wherever they go, that are cellular based devices. So those will work wherever they go. We also have a roadmap into mobile remote patient monitoring through utilizing a single button, emergency response system, commonly called an MPERS or mobile PERS device, having that Bluetooth connectivity while they're on the go as well. So kind of lowering that age demographic that you can support with remote patient monitoring, into being more active people with chronic diseases.
Okay, so thank you for that. And you're right, that cellular component is a key piece. We can't really rely on folks' home networks in most cases, or that they even have internet connectivity. So the fact that a lot of these hubs and the devices themselves are mobile means that they really can go with the user. Last quick question to James, and then we're going to have to move over to our fireside chat. We did have a question about what this future means for the training of clinicians, right? Those going through medical school now, or their nursing programs. How are the next generation of providers being trained for a future healthcare system that might operate very differently?
Yeah, that is such an important dimension to this. And in fact, right now, the way we talk about it, this is 10% about the technology, and it's 90% about the behavior change. Again, we've been doing things for 100 years, a lot of it based on tradition. When I was a cardiac surgery intern, I hate to say, in 1988, every patient got admitted the day before cardiac surgery. They got a Swan-Ganz catheter the night before. They got every lab known to medicine. And by the time I left as a surgical resident, cardiac surgery resident 9 years later, people were being brought into the anesthesia the morning of surgery. And, instead of being in the ICU for 3 days on a ventilator, they were being extubated in the operating room. And, so the point being is there's a wholesale change in thinking and letting go. There's a lot of letting go that has to happen of what we think was the way we did it, and now learning how to do it a different way. And the only analogy I'll give you is in our self-driving cars. We now have cars that have sensors all around the car that are paying better attention to all the information and whether or not you might crash into somebody. And it's applying the brake faster than we're able to process and respond. But when you think about these self-driving cars, there's a level of trust that you have to start to embrace, that recognizing that this car is probably safer with these systems in place than you yourself could respond to. And the same thing happens every time we all get on an airplane. That pilot in the cockpit is relying on an autopilot system, which is watching all the data from thousands of sensors on that plane, and then reducing it down to the autopilot system that will help the doctor or nurse take better care of their patients than they ever had in the past without these systems. So it is totally complementary. It's not a threat to medical practice, but there's a trust of letting go when that new autopilot system gets introduced into your cockpit.
Well, with that, that's going to have to be the last word. Thank you all so much for sharing your expertise and learning and insights with us here. I'm very excited to welcome our President and Chief Marketing Officer, Elizabeth Parks, who will be talking to Karen Seljen with United Healthcare. Thank you all so much. Give us just a minute.
It's a pleasure. Thank you.
We are so excited to welcome you to our Connected Health Summit 2022 series. Throughout this year, we will gather and share Parks Associates' latest research on connected health devices and solutions for consumers, and bring the industry together to share their vision of our future of healthcare. After 2 years of virtual events, we're also announcing the return of our in-person events in 2022. We hope you can join us in September as we gather again for impactful sessions with insights from industry leaders and best-of-class research from Parks Associates analysts. Nothing beats the knowledge, conversations, and community that come from meeting in an in-person setting. We survey 10,000 broadband households each quarter to provide the most reliable and accurate view of the connected health market. This year, Connected Health Summit addresses opportunities for new solutions, including smart home platforms, telehealth services, voice assistants, and wearables to empower consumers, caregivers, and providers with new insight into patient health. Healthcare and technology providers have the opportunity to have an extraordinary impact on health and wellness through new applications and services in chronic care management, remote access to care, independent living, and wellness and fitness. We will discuss consumer behaviors and changing demands driven by the pandemic and new business models, IoT solutions, and deployments emerging to target these new healthcare needs. Thank you again for joining us at Connected Health Summit. Welcome back. I'm Elizabeth Parks, the President and CMO of Parks Associates, and I am so excited to welcome Karen Seljan, General Manager and Vice President of Virtual Care for United Healthcare, as our executive Q&A speaker. Karen has an incredible amount of experience. Her career is focused on developing programs that help consumers manage their complex health conditions, and since 2016, she's focused on developing the commercial strategy and virtual care for United Healthcare, which services more than 25 million consumers and hundreds and thousands of large and small businesses. She's earned the United Healthcare Group Innovation Leadership Shadow Award, given to only a select few who make innovation a true priority. Today, we're going to talk about her views on the evolution of virtual care, the role of partnerships and the complexities that go along with that, as well as the benefits. Please go ahead and put any questions you have for Karen through the chat in the Q&A on the swap card box, and I will incorporate them throughout our discussion. So Karen, welcome. Thank you so much for joining us today. Let's go ahead and have you share with our audience a little bit about your role and the position that United Healthcare has in the virtual care market.
Thank you, Elizabeth. It is a privilege to be here today. I represent United Healthcare, and it is the health plan side of United Health Group. And we touch virtually every aspect across the healthcare system. As you heard, we serve millions of members and over 1.5 million provider relationships. And at United Health Group, we have a distinctive role to play to help transform the nation's healthcare to be more sustainable for the Americans across the future.
Well, great. And thank you again for spending your time with us today. Let's go ahead and start off and just talk a little bit about the evolution of care. Maybe you can go back a few years in time and tell us how this got started. And then, of course, what's happened in the past few years as we've all lived through the pandemic.
Sure can. United Healthcare believes that everyone should have access to health information anywhere and anytime. And we want to be able to help people navigate across the healthcare system. The COVID pandemic triggered an unprecedented spike in virtual care utilization, as we've heard about today, across all of the different healthcare arena. And we know that telehealth has tremendous staying power. When we look at data across our entire book of business in 2022 compared to prior years, it still is elevated against pre-pandemic levels. And we know that it plays a huge part in partnerships with our healthcare providers, all the way to national virtual care partners, from preventing and detecting disease, all the way to helping people manage their chronic conditions. And when United Healthcare started with virtual care many, many years ago, we offered members access to 24/7 virtual urgent care. Members can pay up to $49 to receive 24/7 support. And when you compare that against the average ER visit for these low acuity types of conditions of almost $700, there's significant savings across the healthcare system. And the next component from virtual urgent care, we moved to virtual primary care. We heard a little bit again about that today, where primary care providers can move beyond just acute care and start to manage the whole person, from preventative all the way to chronic care conditions. And we then created last fall a virtual Health First plan, where members can enroll during open enrollment in a product that has a personalized care team that manages and supports them from medical and behavioral, and that they have an assigned primary care physician that they go to be their point of entry across the entire healthcare system. And as we look forward into the future, more recently, we've started relationships on virtual specialty care, such as 24/7 access to a dentist, and even supporting members with hearing aids.
So you're really ending up moving towards this digital first experience, right? Starting out the consumer maybe there, whereas in the past, if there were care providers around the region, virtual was meant to be sort of the last resort. And so are we really seeing things completely flip as far as the view on insurance and delivery of care? And I mean, this is really upside down a little from what we've had in the past.
Yeah, when we use virtual first, we do have a product where that is your first entry point into the healthcare system. And you literally click a button and connect with your care team, and they're able to help you navigate. That being said, we do know there's a role across all the different care providers. If somebody needs to go to the ER, they should be going to the ER. They shouldn't be going to virtual first or even urgent care in person. And so we do know that virtual can play a very big role, because oftentimes people just don't know where to go or even what to do, and if their particular condition merits a primary care physician or even a specialty type of visit. And so virtual does play a role to help get people to the right site of service based on their particular healthcare need.
Okay, great. So playing a big role in helping to educate consumers, or patients rather, on maybe what the first step is for care. So can you talk a little bit about the Navigate Now program? Is that what you were referring to in your previous comments?
Yeah, Navigate Now is United Healthcare's virtual first product that we launched last fall. And we created Navigate Now with one really simple goal, which was to create an accessible, simple, consumer-friendly experience that was centered around people. And so we did a lot of research, both with members and brokers and employers and care providers, technology across the entire healthcare industry, and wanted to create something that wasn't just digitizing the existing healthcare system, which we know is not optimal, but creating something new and truly transformational that helped people seamlessly move in between virtual and in-person. And Navigate Now, when you enroll in this particular product, you're supported by a personalized care team that delivers not only primary care, but also urgent care and behavioral health as well. And it's very simple to connect with your care team 24/7, schedule appointments. This care team acts as your concierge, your navigator across the healthcare system, and is able to help you figure out where you need to go, have an appointment with your primary care physician, and even refer you to in-person specialists or for particular labs and procedures. You may not need to be seen, again, fully in person. You just need a lab or even an x-ray, whatever it may be, for that virtual care provider. And that's part of the reason why we see so many different statistics of how much can be done virtually, because when you start adding in peripheral devices or including some components of the visit, like lab that you would need in person, you can certainly do more virtually than just a regular virtual visit of the years of the past. And so when we look at Navigate Now overall, you know, the results have been somewhat surprising, but not, and that we know that we can lower our plan premiums because members are able to get that lower cost right side of care of service. So employers have been enjoying that about 15% less premiums as a result of this particular product.
Well, that's great to hear. Anything that can bring down the cost of anything these days, I think is great. When we're talking about moving people into this new way to interact with healthcare providers and information about their own care, you know, what kinds of challenges are you having in getting people to do that? And do you have incentives that are driving people to use these digital platforms?
Yeah, we do. For this particular product that I just referenced, members have $0 copays for both primary care and behavioral health because we wanted to remove any of the financial barriers of accessing care so that people really do think of going to digital first. We have data that we've seen that shows up to $67 billion can be saved annually if people visited a primary care physician for their first entry into the healthcare system as opposed to other specialists or services. So it's quite staggering where that primary care physician we've heard is the quarterback. They can help you manage whatever it may be. And so the incentives overall are, you know, financial, but they're also supported through other types of care where you can make appointments, and we've added some health and wellness type of services into this particular product. And so there's a whole host of things of not only managing care, but keeping people healthy.
Okay, great. I think we might have caught a little bandwidth issue there, but we heard what you said there at the end. And now I want to ask you a little bit more about this idea of local versus national care providers. This is something we look at within our research, particularly as it relates to telehealth, but also things like a home security company, you know, consumers really wanting to go to that local provider. And then also watching the tech giants and other non-traditional players jump into the game and, you know, disrupt things quite a bit and perhaps look to move things at more of a national care. So what's your view on how that could work, and also how consumers, you know, whether they care or whether they don't, is this something that we could see in the future that would be a major change, right, in how care is delivered?
Right. There absolutely is a role of local physicians. You can't just do virtual only. So you need to be able to see physicians that are local to you. To help improve access to these local care providers, United Healthcare last year made a payment policy change that allows doctors to be able to get reimbursed for doing telehealth with their own patients. So we've been talking a little bit about national care providers, but certainly local care providers are where the bulk of the visits occur. And in our data, up to 95% of telehealth visits are performed by a doctor and their own patients. And so that demonstrates that members do want to connect with their own doctors virtually in addition to in person. And so this policy that we created helps modernize the industry's approach and supports our commercial membership so that they can continue to use technology to see their care providers if that's the best course of action.
Yeah, absolutely. And I feel like it does speak a little bit towards the trust. And, you know, Dr. Malt brought that up, the trust, the relationship that is there with that doctor and the individual. I do have a question from the audience I want to throw in here real quick. Do other insurers, including Medicare or Medicaid or derivatives, offer anything like virtual first?
There's a lot of, I can't speak to everyone across the industry, but there are a lot of companies that are starting to offer virtual first types of products. And I think something to think about is oftentimes local care providers, there's a lot of health systems on this call. You can see your care provider virtually or in person. And so there's that opportunity to just access the healthcare system virtually, but then there's also products like this Virtual First product that we launched for people who may not have a PCP relationship or want to create that first line of a relationship virtually. So there's a role, again, across the entire healthcare system for both virtual and in-person.
Okay, great. I've got one other question, and it's going into our next topic where we're really going to talk a little bit about partnerships and some of these consumer devices and the services that come along with it. But let me get this question in real quick from an audience member. If a company is working with unique RPM products beyond the standard products that are normally discussed, how would you suggest we work with United Healthcare? These products have been clinically proven by some of the largest and most prestigious academic organizations in the US, but it's often difficult to get traction with payers.
Right. I'm not sure what so RPM remote patient monitoring for the audience, what the particular products are, but this is where it's kind of unique in that oftentimes remote patient monitoring is monitoring a patient on behalf of a care provider. And so United Healthcare's role would be to help ensure that the care provider is getting appropriate compensation for that particular visit. And we've heard a little bit earlier too, that whole move to capitation versus fee for service. You know, we like to say pay for value, but a lot of our relationships with the care providers in the network are paying for value, which then helps create that incentive for care providers to use technology and to incorporate that, whether it be virtual care or remote patient monitoring, into that patient care plan if appropriate.
Okay, great. Hopefully that answered our audience question. Let's move along and talk a little bit about some of these new partnerships that you all have announced. So can you share a little bit more about Apple Fitness Plus or Peloton? What's driving these partnerships? What's the uptake been? How's the response been from consumers? And then retention, just like New Year's Day, everybody's, on a diet and ready to lose 10 pounds. And then 3 weeks later gets back to their normal, daily habits. So tell us about these programs and how it's working out so far.
Sure. We know that many Americans, because of the pandemic, have adopted a hybrid approach to fitness, where they blend both going to the gym and then using at-home exercise routines. And Apple Fitness Plus and Peloton are two great examples of relationships that United Healthcare has created that play an important part in how people manage their health and their health outcomes. We're seeing a lot of interest into these programs. Specific to the Peloton app, we know that our members are completing over 1 million Peloton classes per month, with over 3 classes a week. So it does show you that having that relationship and incentivizing people to stay healthy, as we know, has downstream impacts across the healthcare system. The other interesting fact about some of these relationships is that for people that used Peloton, over 40% of those people who logged into myuhc.com logged on for the very first time. And so creating those personalized offerings also creates that front door so that people become more aware of all the different programs and services and care network providers that they may need for the future. So we know it's something that's really important, that creating these relationships helps us holistically look at our members. But we also know that if we build some of these things, we can't just assume that members are just going to show up. And so we need to be able to create relationships that help people recognize the value of making sure that they stay healthy and improve their health over time.
Yeah, really interesting, and certainly an extension of your brand and marrying with another brand that's got some similar goals and how they're serving consumers. And we're seeing these kinds of partnerships crop up all over the place, OTT services and other different partnerships that can really pull in consumer segments in a new way. So really interesting there. Let's move along and talk a little bit about in-home care. And what's going on here. We've heard all sorts of issues on staffing and labor shortages across every industry, I think, that exists in the United States, but healthcare especially. How is this going to play out in the future with in-home care, and then the hospital to home move, and getting patients out of hospital beds, being more comfortable at home, and having the appropriate care delivered there?
We know that the role of in-home is going to play a significant part of care delivery in the future. While certainly we've talked about virtual care, there are a host of other things that can happen in the home as well. The first one was remote patient monitoring and making sure that people are getting the specific devices that they need to monitor whatever health condition they have. One example of remote patient monitoring is we have a relationship where members can get continuous glucose monitors and manage their diabetes. And that gives people information real time on their blood sugars to help them better understand whether or not they need to take some medication or need to eat, whatever it may be. And a great outcome from that is over 90% of the members who have participated in this diabetes device have lowered their A1C. So that's a significant metric. So remote patient monitoring continues to be a large part. We also know, we hear about at-home types of services where people can go to the member's home and give them care, whether it be nurses or doctors. United Health Group via Optum, our sister company, has a house calls program where there are clinicians and they support Medicare Advantage patients, where they are sent to the home to do a primary care health risk assessment and ensure that the members have what they need at home, if they need any community services and resources. And that gets a significant NPS or satisfaction score, where over 99% of the seniors are satisfied as a result. The last kind of component is like self-directed care models that can happen at home, where members can choose to engage on fitness, like we talked about. We've also provide a virtual physical therapy solution where people can recover from an injury or surgery, or even have musculoskeletal issues. And we know that that's a significant portion of Americans and have kind of MSK types of issues. And so being able to support members and new care pathways and using virtual just has a huge impact across the entire healthcare system.
And so let's talk a little bit about specialty care programs. And so, one, what does that mean? And two, how can that take place? I think a lot of specialty care might involve lab work or really being able to assess the person, maybe physically. And so tell us a little more about that.
Sure. We know that the bulk of healthcare costs are because of specialty care versus primary care. It's a small component of it. But specialty care does have a role in virtual care as well, especially if you couple it with labs or other in-person services. A great example of that is through some of the recent work that we launched on dental and hearing. And your first reaction is like, dental, how can you do dental care virtually? Clearly you can't get your teeth cleaned virtually, but those individuals that virtual visit dental benefit are there 24/7. They can answer questions about that members may have about oral care and if they need to be seen by a dentist. There is also another hearing benefit that we launched not long ago, where members can get a hearing aid delivered to their home and then work with somebody remotely to do all the adjustments. And so there's a whole host of things that you can start to incorporate. We do know, like teledermatology, where you can take pictures or show a provider remotely about a skin condition, has a big part of specialty care. And so there's a whole bunch of different components across the specialty care continuum that virtual care can start to be incorporated into that.
Yeah, absolutely. I can only imagine the big number there on potential cost savings that come in. Let's talk a little bit about self-funded plans. And this is interesting. I want to make sure we tie back into the virtual care. We talked a little bit about this on our prep call, but explain to us, first of all, what is a self-funded plan? What is it that United offers? And then why does this matter in terms of telehealth or virtual care services, based on the information you know about your members?
Yeah, the self-funded plans are employers who are the ones who are paying the claims on behalf of their employee population. And so we offer a host of different solutions. One of them that we'll feature today is called Surest. And Surest is a health plan that has no deductible, and so members' coverage kicks in right away. And we do know that Americans, as we've talked about, struggle with paying for healthcare, and that 56% of Americans would struggle to cover a $1,000 medical expense. So that this particular plan design has a few key features. It has the no deductibles and co-insurance. It also has upfront prices. So we know that often you go to the healthcare system, you don't know what you're going to pay until you get your explanation of benefit. Surest has been able to create those prices up front so that you know what you're going to pay prior to having that particular service. And lastly, this data is very important to be able to give to our members so that there's no surprise billing. They know what they're paying, and it just becomes really simple. And that's going to help control costs for a lot of our self-insured employers who have opted into this particular plan.
Well, yeah, and also providing the consumer with great transparency on the actual cost, which is a big issue for consumers, and also builds onto that trust issue, as far as being really straightforward about what's going on. As far as the group of users of this kind of care, what is something that you all learned about their use of virtual care services, and why is that so significant, especially in considering the future of how care might be delivered?
Yeah, we hear from a lot of our employers and our members that virtual care is just a simple way to go. And through some of our self-insured customers, there's a 10% increase or a 10 times increase in virtual care utilization. People want that first line of defense as opposed to going into the care provider or parking, even if it's in a rural versus an urban location. That access to care is critical. And so being able to provide our members with options of virtual providers that we have relationships with all the way through our network where people can see their own doctor is here to stay.
Yeah, absolutely. It's amazing how quickly 30 minutes will go by. So we only have a couple more minutes for your final comments. But what I'd love to have you share with our audience is what you think the future of advanced care looks like, particularly as it relates to technology that is predictive and proactive. And so kind of big picture question there on technology and its place for care as we move into this post-COVID world.
We know that technology without data and putting context around it is meaningless. And so it's going to be important to know not only the data, but being able to incorporate that holistically about that particular patient. And so creating those proactive interventions using data is going to be critical as we all go forward. Another key trend is that we need to be able to share the data with care providers, with the healthcare system. Being able to do that supports the efforts to make sure that those members get the best possible outcome, and helping employers and others make informed decisions about how they need to invest in healthcare going forward. And so digital platforms, technology, virtual care in and of itself are a great tool, but ultimately, as we heard about, they're supported by the broader healthcare system, a lot of great people, care providers. And so as we think about that going forward, that integration, that data sharing, making sure that people are going to the right place at the right time for quality care and appropriate outcomes, and having that transparent data is going to be critical.
Awesome. Well, Karen, thank you so much for joining us today. Such a wealth of information. And really, I love having people like you be able to speak, especially because you're a woman and a role model for the rest of us out there. An amazing career. So thank you again for sharing your perspective today. We look forward to seeing you in person soon.
Thank you, Elizabeth.
And we'll be right back if you stick with us. We have another panel discussion coming up. Thanks for joining us.
Okay, thank you, Elizabeth and Karen, for that really insightful conversation. If you're just joining us, I'm Jennifer Kent, with, the Vice President of Research with Parks Associates. So pleased to be jumping into our next panel, which is focusing all about consumerization of healthcare, a term that we've heard over the years, and we're talking a little bit about what that really means today. We know that the U.S. healthcare industry is really in the midst of a transformation, including an overhaul of the care delivery infrastructure from physical to digital, and the rise of informed and increasingly empowered consumers. And technology's role in the consumerization of healthcare is a little bit hard to overstate. We see its impacts in at least 5 key areas. First, I say knowledge, right? That consumers have more data than ever about their own health status, from access to their medical records to vital signs that they can track on a daily basis. Personalization, so healthcare moving away from sort of a one-size-fits most to a personalized model of care, more insight into an integration of one's own kind of data, feeding a more holistic whole person and longitudinal view of one's health journey. Cost in the U.S. healthcare system in particular, there's a huge opportunity to bring down the cost of healthcare, and in particular the costs that make it through to the consumer. Access, so telehealth services, from their origin have been about bridging the gaps in care and expanding access to care, to the services, to care services for populations who really need it. And the origins were really about rural populations not having access to specialists or other underserved communities, but certainly telehealth has the opportunity to bridge gaps in care and access to care in all sorts of other ways today. And finally, choice. So across all of these vectors, right, is this idea that technology can perhaps give more choice to the consumer, allowing people to be in the driver's seat of how they want to access care and where and with whom and for how much. We've heard a little bit about that in our discussion so far today. I also just love to mention that, of course, we also see leading consumer-facing companies that are driving somewhat the consumerization trend, but also really responding to consumer demands for new ways of accessing and participating in their own health management, from retailers like Walmart and Amazon, retail pharmacies like CVS and Walgreens, to the tech giants, and really every company on our panel today. These companies are really positioning themselves in this critical position between health providers and payers, and then consumers themselves with a mindset that's really radically different from the traditional healthcare, in that their cultures and their orientation are really consumer first. So in this panel, we'll be talking about how technology empowers consumers in healthcare, about how to move from providing information to action. A lot harder to do, bringing about that behavior change and creating actions and interventions off of the data, and what the disruptive role of consumer brands and retailers is in healthcare as we talk about the shifting focus of the consumerization of healthcare. So as we dive into our conversation today, I'd love to invite each of the analysts to tell you a little bit about something about themselves and about their organizations. I'm going to start with Jeff Cutler, who's the Chief Commercial Officer with Ada Health. Hi, Jeff.
Good morning, Jennifer. How are you today?
Thank you.
Thank you for having me. Hello, everyone. My name is Jeff Cutler. I'm Chief Commercial Officer of Ada Health. I've been with Ada for about 4 years, where I'm responsible for commercializing our artificial intelligence symptom assessment platform for the US market. If you're not familiar with Ada, we were founded about 11 years ago with the idealistic vision of democratizing access to healthcare. We employ over 60 doctors who have built what we think is the world's most advanced medical knowledge base, and we combine that with advanced technology, an AI probabilistic reasoning engine, to help patients assess themselves and determine the type of care they need. We have an award-winning consumer app out there for the last 6 years with over 12 million users, and we now serve enterprises throughout the world where we're reaching over 50 million users. I look forward to a lively discussion today. Thanks.
Fantastic. Thanks, Jeff. Next, we have Dr. Jeffrey Rutledge, who's the Chief Medical Officer with HealthTap. Hi, Dr. Rutledge. Thank you for joining us. Tell us a little bit about HealthTap and your role there.
Good morning, and thanks for asking me to participate today. I'm Jeff Rutledge, the Chief Medical Officer and co-founder at HealthTap, where we have deployed a nationwide virtual primary care service. This service allows people to choose their doctor, establish a relationship, and get ongoing care over time with the doctor that they know and trust. This is built, the service is delivered in a very cost-effective fashion. You can use your insurance or your Medicare to gain access, but it's so affordable that people that are paying out of pocket really for the first time have access to a wonderful doctor they can get to know and trust and get ongoing care. It's built on a platform that we've developed and refined over the last 12 years, which provides an integrated end-to-end experience. The platform also in parallel allows people to ask questions. Whether you subscribe to our service or not, you can ask a question and you get a live, real answer from a doctor. We have more than 90,000 doctors across 147 specialties who've signed up to participate. And those doctors have answered literally millions of health questions over time. So our library of answers means that when you ask a question as a starting point for your health journey, there's already an answer there almost all the time from a doctor. In fact, often several answers from doctors in different specialties. So the platform provides both the services. And if you haven't tried it, I invite you to ask a question, get an answer from a doctor on HealthTap.
Wonderful. Thank you, Dr. Rutledge. I've definitely, instead of Googled, I've definitely used the HealthTap for my first start of where to get that information on any health question I have. So very excited to hear your insights in our panel today. Next, we have Atul Singh, who's the GM for Digital Health with LG Electronics. Hi, Atul. Thanks for joining us.
Thank you. Thank you for having me. Good morning, everyone. Good afternoon, evening, depending on your time zone. This is Atul Singh. I'm the manager for Digital Health for LG Nova. And those who are not familiar, LG Nova is a startup incubator we see, however you want to phrase it, but the vision of LG Nova is to create new business opportunities by building an ecosystem of startups, big techs, nonprofits, and government agencies to work together and develop a more collaborative approach that aims to bring together to market new products and innovations. And we like to call it outside-in innovation. And the 4 key areas that LG Nova focuses on primarily are connected health, smart lifestyle or smart home, energizing mobility, and metaverse. And in this session, we'll mainly focus on the first pillar of connected health, though there might be some opportunities where I can cross over into the other pillars. Thank you, and back to you, Elizabeth.
Thanks, Atul. And yeah, we certainly welcome the insights that LG really has into these other verticals, because for consumers, you know, we don't think of our lives as just, well, I'm a patient today and I'm thinking about health, right? We're interacting with our technologies as we go about the day. So certainly love that well-rounded perspective. Next, we have Kristen Valdez, who's the founder and CEO of Be Well. Hi, Kristen. Thanks so much for being with us today.
Elizabeth, great to see you again, and thanks for having me. I'm really excited to be with you all today. Be Well is a platform where we provide to employers, insurance carriers, health systems, and retail pharmacies a white branded solution to replace the current consumer experiences that they have in order to drive loyalty to what consumers really want out of the healthcare delivery system. We help them to empower consumers and their families to collect and aggregate all their own health information in one location and use that information to create truly tailored, personalized communications down to an N of 1 for the 2 things that consumers want. Be there for me when I need you, and tell me when there's something I need to do. And then we navigate them to care in a combination of in-person, virtual, and digital care pathways so that consumers only need one launching off point to manage all their family's healthcare in one location. So excited to be here with you today and talk through these themes.
Wonderful. Thanks, Kristen. Great to have you as well. And finally, we have Brad Wiltz, who's the Director of Medical Business for A&D Medical. Hi, Brad.
Hi, how are you? Thanks for inviting me. My name is Brad Wiltz. I am the business leader for the Americas for A&D Medical. We're a 40-year-old company, predominantly manufacturing a set of peripheral devices, blood pressure, weight scales, pulse oxes. And our customer base is wide-ranging from mass retailers to healthcare providers through a variety of different RPM partners. So we get a nice slice of the business from a variety of different angles, and very excited for the conversation today.
Great, wonderful. Love all the diversity of perspectives that we really have going on today. We also threw you guys for a little loop from the beginning here by having Elizabeth's label up as I started speaking. So I'm honored and complimented to be mistaken for Elizabeth Parks, but Jennifer Kent here. So we've changed that label, and sorry to throw some confusion into the panel here. So I'd love to start with really talking about what consumerization of health and what a person-centric, consumer-centric way of thinking about healthcare means today. We've heard that term for those of us who have been involved with connected health for a long time, even before the pandemic, but we've had so many shifts in the healthcare ecosystem. What does that really look like today? And do we feel like healthcare organizations are doing a better job about having a kind of a person-centric and consumer-centric view? I'd love to start with you, Kristen, and then head over to Jeff.
Yeah, absolutely. I think, we all experience, because at some point in our lives, we're all patients, but we're also consumers of health. And so as healthcare has raced towards digital, it's become further and further fragmented. We have logins, portals, and passwords for every doctor, every hospital, every lab, every radiologist, every employer-sponsored health and wellness program, all of our HSAs and FSAs, and now what is more than 300,000 digital health solutions that exist in market. I think from a consumer perspective, consumers want one singular location to manage all of their family's health in one place where they have transparency and what CMS, HHS, and ONC are calling shopability. So the ability to have choice in their healthcare services and have recommendations that are personalized and proactively notified to them and their families that could add value to their healthcare journey, where they don't have to spend a lot of time shopping the internet or trying to find a solution to a problem that they may or may not know that exists. And then once they are searching, if there's 10, 20, or 30 different solutions for the same problem, how do they know who to trust? So I would say all healthcare stakeholders that we work with are really focused on not just improving consumer loyalty through giving better access to more comprehensive services all in one place, but also making them more simplified to access by using things like federated identities and making sure that the use of APIs can pass data back and forth without consumers having to fill out yet another form, and starting to really anticipate consumer needs.
Yeah, I love that perspective. I mean, especially the point of APIs being able to just do it in the background, that really takes jobs off of the person to know where they should even go to look for their own data and make those connections themselves. Jeff Cutler, over to you. Kind of same question. Do you feel like you're working with a lot of large healthcare systems in providing some of that kind of front access with your solution? So where do you think we are at with having a more person-centric approach to healthcare?
Well, first of all, I agree with everything that Kristen was saying. And I think what we need to do is kind of look at the disruption of some of the other vertical industries that we've seen in the last 10, 20 years to understand what's happening to healthcare. Kristen talked about the different silos and all the separate logins that we have. Think about banking or travel 10, 20 years ago. And, what we were dealing with. And we saw this upstart of whatever you want to call them, fintech companies or travel tech companies. And we all looked at them and said, these fly-by-night startups, how are they going to be successful? But they solved that problem of the siloed data and the access and meeting consumers where they were, and they were successful. And as a result, they transformed an industry because we have the benefit of watching or understanding what consumers want by watching their actions, watching their clicks. Healthcare, if you think about it, is the only transaction in our life where historically we're not allowed to question things. Think about any other transaction in your life that you don't ask the price, you don't ask if there's choice, you don't ask. Imagine asking a doctor, well, how much do you charge? How much does the doctor around the corner charge? What's your success rate? How many times have you done this? All of that information is starting to be exposed, and it's really putting the consumer in the driver's seat. At Ada, as I mentioned before, we have the benefit of serving over 50 million users worldwide. So we've really gotten to see how they act. We're able to see what their intention is when they seek care, and then we're able to understand afterwards what care they actually needed and where they went. And we're able to use all that data to really help our partners better manage their care services.
Yeah, that's interesting to be able to know where they've come into the system and then where they went, and maybe was that the right path? Are your system clients starting to look at the data in that way to change their flow, their navigation essentially of a patient through the system?
From our perspective, absolutely. It's interesting because trends globally tend to be relatively consistent. So one of the things that we've seen is globally, about 13 to 14% of all assessments result in self-care. Now, these are people that were either heading into a direct primary care visit, a telehealth consultation, or even an emergency room encounter that found out that they didn't necessarily need that. So our partners are looking at that and doing some very interesting things around it. For instance, we now serve as the digital front door for Kaiser Permanente across their system. And one of the things that they're now doing is patients that we identify that could benefit from self-care, they're driving them into a chat, either with a clinician or a pharmacist, so that they can understand what type of self-care they can do. So we're absolutely seeing the health systems and our partners starting to embrace the data and redirect patients accordingly.
Now, Dr. Rutledge, I had mentioned kind of in my setup to the panel that we see technology's role in the consumerization of healthcare, serving multiple different purposes, whether that's just really bringing the information to light, lowering costs, providing more access. How do you feel like we're doing and achieving those, multiple goals, specifically when it comes to, technology kind of enabling this consumer-centric view.
Thanks. I think we're at a very powerful point. I'd first like to start by saying I agree entirely with everything Jeff said about the availability and power of the technology to make pricing and other structural features more transparent to patients. But it's really important to understand how bad we've been as doctors and in the healthcare system in managing the experience that people have. And although I'm not sure I like the term consumerization, as a doc doesn't make me feel real warm and fuzzy, at the same time, it's really wonderful to see how it's possible. And what we've done is use the technology to make it easier, to make it faster, to make it more convenient. And also, interestingly, something that may not be immediately obvious to folks is that the cost of brick and mortar and the structure of buildings makes delivering primary care in the office setting way more expensive compared to what's possible to do with the technology. So having a technology solution, a digital health platform, lowers the cost and increases transparency, and it's more convenient, and you can do it from home, and it costs less. And there's another layer, which is even more amazing in my view, which is that in the in-office world, it's become so hyper efficient that doctors just are being pressed to spend less time with their patients. When you have a less expensive platform and doctors who care, who actually want to connect with their patients, you can have more of a connection, more of a personal interaction, where every visit is like a house call with your doctor, and you get to know your doctor and see them ongoing time. And that's only possible because of the technology, which I think is an amazing advance. And finally, I mentioned that primary care, it should be easy to access because people don't know what the next level of care should be. And in order to guide people to get care when they do need more than what's possible to do virtually, having a doctor who knows you, who's easily accessible at a low price to you virtually from your home can be an important guiding factor to get the right care. So you're not getting unnecessary care. You're not getting care that's more urgent than it needs to be. And when you do need care, the doctor's there to convince you to go get the care you need. So it's a win-win all around as far as I'm concerned. And, as we talk about this nationwide primary care practice, everyone should have a doctor immediately available to them, even if they have a doctor in the office to go see when they need to.
Yeah, I think the concept of virtual primary care is so interesting because I think in the early days of telehealth, there was the feeling that, well, consumers want to know their doctor and not just any doctor, and that maybe with the annual visits, maybe primary care wasn't a place that you can build a relationship, but I don't think that's necessarily proving out, right? That you can build a relationship with someone virtually. Would love kind of your thoughts on that.
When we got started, we were, as all were transactional oriented, people with immediate need. Find an online doctor now. I have this itch, I need to scratch it. I have an ear infection, I need an antibiotic. And people were looking to solve the immediate problem and not thinking of it. And I have to tell you, I personally thought of virtual care when we got started as an adjunct to in-person care. That once you met the person in the office, you could then do intermittent care, just like you can do a phone call with someone you know. And that virtual care would be an adjunct to in-person care. The realization and the development, the experience, however, showed something different, which is that you can meet people and get to know them and have an even more personal relationship with someone you meet virtually. And that virtual first and virtual only actually has huge power for the vast majority of people that don't actually need care in the hospital or an in-person setting. And that person, again, as I say, is incredibly valuable to guide you to situations when you do need care that's beyond what can be done virtually.
Now, I'd love to go to Brad and Atul next, specifically, taking the devices kind of point of view here. So, Brad, from A&D Medical's point of view, can you tell us a little bit about what it means for devices to be in the hands of consumers and how kind of those deployments are looking? I believe you guys also maybe have a partnership with Walmart. When you think about the channels and distributions of getting devices out into consumers' hands and how that changes the game and kind of gives them the more power into seeing what their health status really is.
Yeah, I think when I think of consumerization, it's really customization of that consumer experience, right? So providers now have a better opportunity than ever to really get a sense of how individuals do outside that office, right? So they have an ability to adjust care plans. If it's an active RPM program that I've been doing this for years, now you have a sense of doing it in a variety of demographics, right? We deal with a lot of people yet still just younger demographics, grab something off the shelf. They just want to manage stress. And they want to engage in a different way that doesn't just involve going into the office. there's a lot of complexity here, right? Around, and we heard this earlier in some panels around liability, reimbursement that still need to be resolved for. But now the technology is there to create a really unique patient experience, right? Something that's really customized for myself. You have a better chance of driving better compliance because it's tailored to you, and therefore, start to add the outcomes, all the other derivative benefits of it. But it really starts with the patient really has created something that they can use, they can drive, and they feel like it's created for them.
Yeah, absolutely. And I feel like that's something that we haven't really experienced that much in our own individual lives, is a personalized, type of solution in the healthcare space. But we're used to it in many other aspects of our life, right? Our Netflix feeds are personalized to us, right? There's our shopping, recommendations on Amazon, and so certainly that's something that consumers bring with them into healthcare as well. Now, a tool from LG's perspective, very interested in understanding, how you think, the role of a company like LG, consumer facing, but also, of course, you're creating devices that go into healthcare facilities too. It's interesting to think about, let's say, the TV as a platform for access to care, and how that might reach a different type of consumer. You want to tell us a little bit about that?
Sure, absolutely. So television is one of the data points, if you will. Pretty much any electronic that LG is producing, consumer electronic in your home, has an IoT embedded in it, and because of that, you're able to connect to one of our platforms called the ThinQ. And all it is doing is collecting data on different appliances to make them more effective and efficient for your home. So think about a similar use case, but using televisions that are perhaps hospital grade or medical grade devices that we have in the marketplace. And if you're able to connect those devices and the data points we are gathering on those devices through this ThinQ platform and be able to offer it to the providers. So this goes back to the comment that Dr. Rutledge made earlier around lowering the cost of care. So the view is that if we are able to collect all these different data points and be able to provide it back into the provider setting through an EHR interface, this would allow the provider to be more efficient in terms of providing care. Much more complete information would be available to them for diagnosis and treating patients. And at the same time, it would also reduce their administrative tasks of record keeping. So overall, we believe that the more data points we are able to collect, the more we are able to pass it on to the provider settings, the more engaged the consumer would be in the management of their own health. And through that, we believe that it'll improve the health outcomes of those patients, the more engaged they are. And hopefully this is going to also lower the cost of care.
Absolutely. Now, I know that LG has a partnership with Independa, which has a specific solution for seniors and their family caregivers, where the TV is sort of the central hub for this experience. Can you tell us a little bit more about that, which is a kind of interesting use of the TV platform for a specific segment of the population with some specific, care needs?
So our partnership with Independa is basically addressing the market need of offering consumers who have, of course, the smart TVs, the LG smart TVs, be able to access a variety of healthcare services from the comfort of their homes and prolong a healthy and independent life, which actually underpins one of the core tenets of LG, which is innovating for a better life. So we want to bring innovative solutions to market to enhance the lives and well-being of our customers and consumers. And we are seeing that especially in the senior category or the senior segment, if you will, that as the population ages and the provider shortage, which is being forecast, is materializing now, digital channels will be more and more utilized to meet the demand of connecting seniors with providers. And also what we are noticing is that the Gen Xers, the baby boomers, whom initially we considered were not as comfortable using technology to connect with for the healthcare needs and connect with providers, are indeed actually quite comfortable and are demanding access to technology-enabled care. So with that backdrop, we worked with Independa to bring a host of healthcare related services to the senior market.
Awesome. Now, I'd love to pick up on something that I think Brad was saying and bring it back to you, Jeff, around the personalization of care. So a lot of what you're doing, Jeff, involves machine learning and AI algorithms, right? Especially on the symptom checking side and understanding possible diagnoses and especially rare diagnoses. Can you tell us a little bit about kind of what's the state of the market and the bleeding edge on some of these technologies that are helping to even more personalized care and maybe uncover insights that wouldn't have been possible even a couple of years ago?
Sure. Well, when Brad was talking about it, I was thinking of a concept I used to think about from a prior industry I was in, where we used to talk about this concept of mass personalization. How do you personalize for the masses all through the technology? And I think that's kind of where we are at healthcare right now. In particular, what we're finding is some of the, what I'll say, final agreements on some of the standards, things like FHIR and, where HL7 is today, are enabling us to personalize things a lot more. So for instance, when we start an assessment, we always start with basic information, their demographics, name, age, sex, and their risk factors. And what we're now doing with our enterprise partners, which include Sutter Health and Kaiser Permanente here in the US and many others globally, is we're able to pull data from other sources to make it more personal. So before they even start their assessment, we're able to factors from their own electronic health record. And then afterwards, we're able to, to a point that I was a tool was just making, we're able to make all that data available to the, I'll say clinician, but really to that next step of the patient journey. And what I mean by that is we take the entire assessment, every question, every answer. We take our analysis and come up with the list of differential diagnoses along with the probability. Past that, if it's doctor in a telehealth consultation, they're getting all that data and able to completely start the consultation from a personal perspective. If it's a chat with a pharmacist, they're getting all that data. If it's an asynchronous chat, same thing, we're passing that along so that the users aren't burdened with having to keep on repeating their information and at least are feeling that they're getting that much a greater personal level of service. The other thing I'll just mention that we're just starting to do, because it's very exciting to both us and our enterprise partners, is using the data for early personalized risk detection. So if you go to see your doctor and you're just going in for a common cold or the sniffles, but he happens to notice some symptoms that you might be at risk of something else, you'd certainly hope that they would raise that. And we're now doing that. So if someone comes in for an assessment and as part of the answers they gave us, as an example, if they tell us that they're dehydrated, losing weight, urinating frequently, we'll come back to them after we complete the assessment and give them the care and say, something in your assessment indicates you might be at risk of type 2 diabetes. And what we're now doing is on our consumer app, directing them to the American Diabetes Association, where they're able to take a test. And we're also now, as of the last couple of weeks, actually offering home diagnostics so they can take it one step further and actually determine it. And same thing on the enterprise side. As an example, we're looking for that early risk identification to drive them into our partners programs. So you may have seen that Sutter Health has announced Scout, which is a very advanced mental health platform coming out of COVID for young adults and adolescents. And next week, we'll be integrating that with our platform for them, because over 20% of all assessments indicate some issue with mental health. And what we're going to be able to do now is go back to that audience and direct them directly into the services that are going to be able to be helpful to them. So I think that's a few examples of what we're seeing with the promise of personalization here.
Awesome. Now, Jeff, we've your video feed's frozen a little bit, but we were able to hear exactly what you were saying. So thanks for that. And you raised a good point on mental health, which reminds me that we have a poll out to the audience right now on which segments of healthcare do you think would be most disrupted by consumerization in the next 2 years? The pharmacy, senior care, chronic care, primary care, mental health, and behavioral health. So if you haven't taken that poll yet, we'll give you some time to answer that poll. But first, I'd love to really go back to Kristen and then maybe Dr. Rutledge about, our data has shown that the majority of consumers, at least in U.S. households that have internet, have engaged with virtual care in some way in the past 12 months, whether it be a telehealth visit or even remote patient monitoring through its various forms, right? So how do you feel that some of this is very experiential, right? That consumers didn't really understand what it meant before. Now we've all kind of been forced to use it in the same way that many providers have been forced into providing virtual care for the first time, and then you kind of see the possibilities. So now that there's this rising familiarity and use with various virtual care, connected health solutions, is it changing, what they're looking for, or changing what you feel like consumers are demanding and want to see? And I'll start with Kristen and then go to Dr. Rutledge.
Yeah, I mean, I think that Dr. Rutledge said it really well earlier. I think a lot of preconceived notions around who will or who won't use digital and or mobile solutions is not proving out to be what we thought it would be. In some of the early solutions that we did in the first parts of COVID around how do you triage people to help them sign up and get ready for, vaccination and navigate them to the right places. Call centers and websites were being crashed because people were really looking for these things. But the reality was that we saw, because of the first wave of who was eligible for vaccine, I mean, some of our first patients were 98 years old and on mobile. And so I think it's not just that people are comfortable when they're forced to use a mobile or a digital solution. It's also that they oftentimes prefer it. So many of our health systems, where we're helping them do things like book appointments online, hold place in line at urgent care, fill out pre-visit forms and things. When you look at their stats from an in-person or a call center perspective, you're seeing a lot of net new patient acquisition as a result of offering digital offerings. So people walking into an urgent care or new primary care setting, if they have to pick up the phone and call, might be 20 to 30%, kind of new acquisition. But when you offer digital, could be 30% higher than that. And so when we see that sometimes when there is an offer for a digital solution, and it's why you're seeing people like CVS and Minute Clinic partner with Google, so that when somebody's searching for a clinic visit, they can hold their place in line and book the appointment, because they're more likely to get that care from people who simply don't want to pick up the phone, or quite frankly, can't pick up the phone, because I know many of us are on Zoom meetings and other environments all day long. It's easier to work in parallel to those mobile and digital solutions. So I think that there's an overwhelming demand, quite frankly, from consumers, and the data is proving out now that people overwhelmingly do prefer digital for administrative type support in healthcare.
Yeah, and again, that does ride consumer behavior and all sorts of other aspects of life, especially with the younger generations, want to text or chat and not pick up the phone and talk to somebody, right? And also very inefficient. And so great to see kind of those shifts happening. Dr. Rutledge, same question to you as far as, the fact that consumers have really raised the level of engagement and understanding of what's out there. I feel like that moves the cycle forward in a dramatic way, but also maybe changes where the focus is. What are you seeing?
Well, COVID had a dramatic effect to introduce people to virtual care. So many more people had their first experience dealing with the doctor remotely that they had not done before. So that was a really wonderful step forward, if you will. But at the same time, we're still in the early phases of people understanding this idea that it doesn't have to be just a digital transaction like visiting an urgent care center, which is different from having your own doctor. The tradition has been you see the doctor in the model of an urgent care visit. And people are still not expecting or understanding that you can choose your own, meet, and get to know and keep your doctor online. And that's kind of a cultural transition I think we're just getting started with. I wanted to go back, if I could, real quick, a second to comment on something Jeff said about the use of the technology on the platform and how AI drives intelligent behavior to the platform. I wanted to point out that one of the side effects of having care being delivered on a virtual care platform is that the data are all there. And now, instead of thinking of AI versus the doctor, should I do the AI or should I do the doctor, we're using the technology as a way to support the delivery of care. And as Jeff really, I think, well described, when you have all the data there, you can summarize it and have an intelligent agent looking at it, making inferences. So, on HealthTap, for example, if you start with an AI-driven patient interview, and you kind of need the AI to know what questions to ask, just to do the routine question asking to present the data to the doctor. But if you use the AI to drive the questioning in advance of the visit as a pre-visit support to make your time with your doctor more efficient, then one of the wonderful side effects is you can show the doctor what the AI thinks the doctor should think about. In fact, I studied this and showed that when you gave doctors a list of alternative diagnoses to think about for a given case, they were more likely to recognize the more unusual case and are more accurate in their diagnoses just by suggesting things to think about. Not saying, hey, I think it's this, but rather, for someone like this with these answers to all these questions, here's a set of things that the doctor should think about. And when you showed their performance before, with or without this pick list, this prompt list, the doctors were more accurate when you showed them the list of things. They already knew the diagnosis, but they didn't already always think about them. So the technology can support the role of more traditional healthcare, make it faster, more efficient, and also lower cost.
Yeah, and it also rides on something a point you made earlier too, with the time that you get with a provider in a certain session too. We're asking providers sometimes to do the impossible, to think about all of these different possibilities in the limited time that they have with a patient. So really supporting that visit and supporting the provider with new information. Now, a tool I'd love to get your thoughts too on the fact that something you said earlier was about, the integration of devices, and especially since LG has the ThinQ platform, right? That brings across all sorts of connected devices throughout the household, as well as maybe bringing in some more medical grade devices too, as you work with partners and evaluate that. But we know also, of course, LG has all sorts of smart home devices that you can bring onto the platform, right, and connect. What do you think the opportunity is, or where do you think consumers are starting to think even beyond just, well, health is this, right? Or these specific medical devices, and a little bit broader into what insights you can get, from the psychosocial or behavioral or household kind of point of view of a consumer in their health journey?
Yeah, that's a great point. And we are definitely looking into what types of data elements that are meaningful for whether it's social determinants of health, if you will, or some other ways to indicate the health of an individual living in a home surrounded by these IoT type devices. We are looking at different algorithms that would look to collect all these data points and create a map of the health of an individual. So those type of concepts are being looked at. They are not in the market yet, of course, but our ThinQ platform, as I mentioned earlier, is a pretty strong channel through which we are able to aggregate multiple data points and be able to then analyze them in terms of the health dimension of an individual, but also other aspects around the social. So more to come on that, but definitely it's an area that we are very, very closely looking and very interested in.
Okay.
I'll leave it at that.
Great. Now I know that Jeff wanted to chime in on something that Dr. Rutledge said, and then I'm going to come over to you, Brad. Go ahead, Jeff.
Great. Thank you. I appreciate that, Jennifer. There's this notion out there, and it's been sort of propagated by some of our competitors, at least what I'm hearing, that, ultimately AI and these platforms are going to replace doctors, and nothing could be further from the truth. And I've heard this from a lot of our partners. There's a great quote. I'm not sure who it's attributed to these days, but there's this quote that says that AI will not replace doctors, but doctors who use AI will replace those who don't. And I think it's very accurate. We actually have a study, a couple of them. They're on the research page of our website, but we did one where we compared the accuracy of our platform against 7 or 8 other platforms out there, as well as doctors. And it's obvious, nothing beats doctors. But what was really interesting is, to Dr. Rutledge's point, when we did another study where we then put the assessment data and that list of differential diagnosis in their hands, it improved the doctor's accuracy, even though it was already the highest, by as much as 2 to 1. So, just really wanted to accentuate his point, because I think it was a terrific one he made.
You confirm my study, Jeff. Thank you.
Moving the perspective on AI and healthcare forward together. I love it. So next, I'd love to come to Brad to get your thoughts on the types of companies that are entered and really are here, right, from the consumer realm, playing a large and growing role in the ecosystem. Huge deals and announcements and purchases and acquisitions being made by Amazon, right? Partnerships for Walmart, CVS, Walgreens, right? The tech giants, Apple, adding more and more sensors to their wearables. Samsung's doing the same thing. And of course, you sell your products directly to consumer as well. So really interested in understanding how these large consumer organizations, right, are really changing the landscape and what it means for the consumers kind of position and power, kind of, if you will, or empowerment as it stands in the healthcare ecosystem.
Yeah, I think the big transformation, over the last decades, right, is these are companies that sold products to consumers that had data. Now they're a data company that has products. They know every single thing about us as consumers, right? Our motivations, our buying behaviors. I know for a fact Target knows every single thing about my family, right? Just based on what shows up every day. But I think what they're trying to do, as you mentioned, right, from partnerships, acquisitions, and even hiring practices, they're trying to correlate how does what they do really well at a retail level correlate to understanding the consumer's health. And how does that track then back to revenue at a store level in online? I kind of equate it to a health system, right? And they work in similar parallel fashions, right? The health system, that provider wants to keep that patient within the walls of their own hospital. And retailers, these large companies, are looking at it in the same way. Like, for example, you could go into any you showed a list of all those retailers. You could walk into any of those stores today and grab a blood pressure, and they have some sort of app tracking right with that retailer. And what the next interval of that is say you can answer a handful of questions, identify as hypertensive, and there's probably going to be a pre-list of grocery items that you can order right in the store level or online and have it same day or next day that correlates to lowering blood pressure. And you can do that all the way across the board. And then it'll start to tie in, with the other panelist products, right? And start to coalesce a much larger set of circumstances. But at the consumer level, they're going to try to make it easy, right? They're going to say, here's how you feel. Here's the things that you can correlate with that. And oh, by the way, you're in the store, it's on aisle 5, right? Just go do it. And they're making it easier. And then they start to go bigger and add partnerships, with health systems and say, hey, if you're feeling bad, here's what you have, we can go ahead and schedule it for you. Like, it starts to move in that parallel fashion.
Yeah, I think that's really interesting and important. And it's not only just that it's in aisle 5, but it's, hey, do you want us to send it right to your home for you, or use your smart lock? I've noticed some of the like Walmart's in-home care delivery. This is on the smart home side, but they have partnerships with smart door lock companies that if you have pharmaceuticals, right, that you're getting delivered through Walmart's pharmacy, they can put it in the home or even in the refrigerator if it needs to be temperature controlled, right? And closing some of the gaps to access to medications. And it's really interesting to see how the companies that have some logistics and other assets to bring to the table can be applied in a healthcare sense.
Yeah, and I think just to add on to the comments that were just made, there's a couple of examples that we're seeing that showcase the move towards, the consumerization of healthcare, which is around choice and access. So it's about knowing someone, right? And so if there's a message from a doctor where somebody's due for a colorectal cancer screen, you can offer the consumer to come in and mobile schedule an appointment with their doctor. Or now, because of these unique partnerships, thanks to technology today, you can say, or I can send you an FDA approved toilet water test to your home and you can drop it back in the mail and we can follow up with a telehealth visit. Or alternatively, I see you're picking up your medications from the pharmacy on Friday. The pharmacist can give you a Cologuard kit, answer any questions that you might have and show you how to use it. So what we're starting to see is the consolidation and the convergence of traditionally siloed stakeholders starting to partner together to reach people where they are, but then also to add value based on that knowing someone. So starting to merge healthcare with retail. When we see someone is taking a medication where they can't be in the sun, or they have a condition where they can't be in the sun, pushing forward offers that say, hey, we're running a sale on your favorite sunblocks. Here is the, world report on the best sunscreens, now that the sun is out. Would you like me to add a few bottles to your, your pharmacy order? on pickup. So being able to move healthcare into something that can be convenient and helpful for consumers and their families is now possible because of the interoperability and the more streamed data environments that we're now starting to operate in, thanks to FHIR and some of the other rules. So I think we're going to also start to see a lot of convergence where traditionally companies that don't work together or giving consumers only one pathway to close a gap in care is going to start to change. And we're going to be able to learn even more from the data science around people's preferences so we know how to target them better in the future.
Right. And some of what you're talking about too is about a change from information to action, right? Which we've had struggles with, right? You can bring the information to people, but behavior change, behavior modification is very, very difficult. Some of what you're talking to and what Brad mentioned too around diet and nutrition and groceries, right? Really can maybe start to at least pull on some of those levers for behavior change. Now, I'm going to go ahead and bring in the poll results here. I think these are interesting. So again, we asked what healthcare segments will be most disrupted by consumerization in the next 2 years. Had a limited number of options to give. I gave them pharmacy, senior care, chronic care, which there's some overlap there, primary care, mental health, behavioral care, and nobody agrees. So it is completely widely distributed between about 15 to 25% of people selected something. So nobody knows. Maybe that means everything, right? Maybe I'll go to Dr. Rutledge first for your thoughts or reactions kind of to that poll.
Well, there's a little bit of all of the above, isn't it true? I mean, the reality is it's not going to be one or another. It's having an impact in each and every area. I would argue that the pharmacy impact is almost already there. I think people are currently used to getting their drugs and medications now through online methods. The online information about drugs is pretty phenomenal. But I think we're going to see huge advances. There's a lot of talk about mental health and behavioral health and how that's making great inroads. That's clearly going to happen. I'm personally, of course, as a physician, giving care most focused on the delivery of traditional medical care, and both senior, chronic, and primary care are all areas where everything we've talked about today has an impact on each of those areas.
Yep. How about Atul to you? And then Jeff, I saw you came off mute. I don't know if you wanted to chime in here, but anything in particular stand out to you from this poll?
No, it's pretty much all of the above, because each of these areas are ripe for disruption. And I think to the point that Kristen was making earlier about pharmacists being able to do more and maybe practice a bit to the top of their license is very important. And I think there are some bills in the Congress to support that initiative. Because there are certain situations which does not require a physician or a doctor to be present in order to provide that sort of care, and it can easily be handled by a pharmacist. And also what we are seeing is primary care is ripe for disruption. We are seeing multiple of these new models in the market. But also, if you just take a step back and think about why this is happening, I believe there are two main reasons. One is the high deductible health plans that are driving consumers to take charge of health, basically since they are paying out of pocket. So things like ordering home test kits, buying wearables, apps, accessing providers on their terms is all something that the consumer is very keenly watching. Now that they are the ones on the hook for paying the bills. And then millennials and soon Gen Zs, who are used to ordering a cab in a matter of minutes or getting food delivered to their homes on demand, are a little intolerant of inefficient services. And that's where I think primary care, urgent care, those type of services are ripe for disruption.
Absolutely. And I think Dr. Rutledge actually has a question he wants to throw out.
I don't know how many people on the call are old enough to remember the Jetsons and how Mrs. Jetson in the living room would pull down the giant TV and the doctor appeared on the TV and then looked into the mouth of the child and the care was delivered from home in a virtual fashion. When's LG going to have the Jetsons?
It's coming. We'll finally have it now.
The pieces are all in place. It's now possible, right?
Yeah, absolutely. It also, to me, though, speaks to you can see the doctor on the screen, right? I think it'll be interesting to see how it shakes out between that and a phone that's a personal and maybe take it into your room versus a household visit, and then also having the devices to what you've spoken about earlier, Atul, to be able to have a good, let's say, camera view. With a smartphone, you have a camera built in that you can see. LG, I believe, is doing some camera built in, or maybe that's on the future roadmap, right? Do you have the lighting? Can you have that same optimal telehealth visit? Or what accessories do you need to really make that possible in the LG on the screen? So very excited to see how that kind of all develops in the family room.
Absolutely. And if you think about it, with the hands free now, if the user is looking at a television and interacting with the physician may ask them to do a lot more, maybe stand up, bend, do certain things that they would not be able to do if they had a smartphone in their hands. Similarly, the background of the house would matter now, because now the physician can see where the patient lives, or what are the conditions surrounding them, and that may influence their decision in diagnosis and treatment.
That's a really great point. So actually, I think we are just about out of time. So I think that will have to be the last word. I really appreciate all of the insights that you've all shared with us today. Certainly, I don't think that there really has been a time in the more than a decade that we've been following connected health that the consumer has been more empowered. There's a long way to go, and appreciate all of your efforts and what you're doing in your businesses to make that happen. So thank you so much for joining us today.
Thank you, Jennifer.
Thank you.
Thank you.
Thank you all.
Bye.
So to the audience, so you know what's next up, our next Connected Health session is October 6th, and we're focusing the full session on seniors and caretakers. We know that older consumers want to live in their homes independently, well, safely, as long as they can. And certainly we've also learned a lot about the realities of caretaking and the opportunity that technology really provides in serving seniors and their family caretakers better. So join us on October 6th for those sessions. Thank you again to our sponsors for Connected Health Summit, including ADT Medical Alert, Alarm.com, Early Sense, Johnson Controls, Rapid Response Monitoring, Beckler, and Independa. Thank you all so much for your support. We appreciate it. If you have missed our series from earlier in the year, you can access the video from all of our sessions to the SwapCard platform. So you can just do replays from January, from March, from June. We've been having these discussions all year. So we welcome you to check those out. And again, join us on October 6th. And Parks Associates fielded its annual Connected Health survey of 5,000 U.S. internet households in May. And we have published the quantified consumer all around telehealth and remote patient monitoring and the user experience. And we are just about to publish the one that focuses specifically on seniors and the technology that keeps them safe and well and independent in the home. We also have an upcoming industry report on the state of the market of connected health at home. So please check out all of that research and let us know if you're interested in seeing it. We also provide custom marketing services. So if you're interested in working with us to provide a research-based custom white paper, webinar, or joining us on our podcast, we certainly welcome that as well. And so please reach out to us if you're interested in any of those opportunities. Ashton, Jason, Mindy Sue, myself, we're all happy to talk to you about those opportunities. Thank you all so much, and we'll see you again in October.